Bonjour Cécile, bonjour pour qui fait que nous aussi. Aujourd'hui, nous pour cause inciser la santé, inciser aussi qui préoccupe nous cause l'obésité. Et aujourd'hui, nous invitons c'est Dr. Eric Licea qui est General Laparoscopic Consultant et aussi surgeon. Et aussi, nous pour tous un petit peu l'ossa ellipse balloon, ou soit nous capables de dire gastric balloon. Alors, aujourd'hui, nous cause l'obésité. Nous interview IN qui pour en anglais à cause de Dr. Licea et pour cause en anglais. Alors, au de la cour, fait confortable et n'ava cause là. Good morning, doctor.
Good morning, Seychelles.
How are you today?
Good, happy to be back to Seychelles again.
I'm happy to see you as well. So you can say bonjour, Cécile.
Bonjour, Seychelles.
So we talk on obesity. What is obesity?
Okay, medically speaking, we as a doctor classify, mention obesity when the person has a excess of weight or excess of fat in the body. It is a medical condition. It is important. It is a medical condition. And to determine that, we use a tool. The name is body mass index, where we correlate height with weight.
So we call it a BMI.
BMI. When the BMI is between approximately 26 to 29, almost 30, we classify as overweight. When it is above 30, then we consider there is obesity.
What is its symptom for obesity?
Well, the main symptom is when you see that you're enlarging your perimeters, that you may start developing as well joint condition because of the heavy that your legs, your joints cannot take. It depends as well because obesity is associated to a lot of comorbidities. So it may develop with, for example, high blood pressure, high blood sugar, heart diseases, lung diseases, infertility. Many conditions can be associated with obesity. Mm-hmm. So it is difficult to mention one or two.
Other causes of obesity? Are there any other causes of obesity?
Well, obesity is the result of a chronic imbalance of the energy intake and the energy we use for metabolic process and as well for physical activity. When we ingest more food, it means energy that we use, then this energy is going to be stored as fat. This is the only way we have to store the energy that we don't use. This is our fuel tank. Other condition, well, I can tell you that approximately almost 70% of the obesity is connected to genes. It doesn't mean that there is a gene for obesity, but our genes will determine our behavior of how to eat, how we use the food that we eat, our tolerance to exercise, as well connected to our metabolism. There are other situations as well that can produce a weight increase, like some medications, some as well social economic activities. It is important as well. Our physical activity, the way we eat, the timing, all this is important.
So, do we say, or can we say, obesity is a disease?
Definitely. And this is very serious, because every time we see a patient for consultation and we ask for health conditions, they usually do not see overweight or obesity as a disease. They think they are healthy, and this is a mistake. We have to be conscious, and we have to raise up the awareness that obesity is a serious illness, serious disease. Obesity kills.
But can it be avoided or prevented?
Well, this is, all our efforts and the authorities' efforts should be directed towards prevention. Once obesity is there, it's very difficult to tackle it. It's very difficult to make the person lose weight. It can be prevented.
So a person finds it very difficult. They tried everything they can to lose weight. Why isn't it working?
Previously, we used to blame overweight and obese people for their obesity. But nowadays, it is proven that they are not responsible for that. Okay, you may be responsible for getting to that overweight or obesity, but not to lose weight, they are not responsible. it is very difficult to lose weight. They cannot lose weight. And what most common is when they lose weight, there is a rebound. They will gain weight, even more weight than the previous weight when they started dieting or physical activity.
So can we say that obesity sometimes it comes from the family history?
Definitely. Not only family history, family history not only connected to genes, but it is connected as well to family habits. When you have one parent with obesity, there is a 50% possibility that the children will be obese or overweight. And when you have both parents with overweight or obesity, this percentage rises up to 75. So it is very important. And as I mentioned before as well, the genes. 66% to 70% of our genes will tell us if we may develop or not obesity. It is connected to the family, definitely.
Mm-hmm. Is weight loss surgery at risk? Is it a risk?
It is very risky procedure. Nowadays, because we perform it more and more, the surgical risk of the procedure, we have managed to bring it down below 1%, but the risk is high, and as well there is a lot of chances of dying during the procedure. And as well, the conditions that may develop after the procedure are serious. Most of the patients after surgery, they will need to take supplementation for life. So this is a burden as well for the health.
It can be complicated as well.
Definitely. It is one of the most complicated surgeries. It's not an easy or simple procedure to perform.
So what is the condition after the surgery?
That's it. Most of the patients, they lose weight with this type of procedures, but they will need, most of them for life, supplementation, and they will develop anemia because they will suffer from malabsorption.
It will take time and effort to change a person's life on the eating habits to stop the obesity. What do you recommend?
It takes a lot of effort and time, but it has to be it is a personal desire or a personal effort. We have to be really commit to lose weight and to keep it, because it is very difficult to lose. But even it is more difficult once you lose weight not to gain back. So prevention has to be directed first to prevent people of gaining weight. When they lose weight, to prevent those people to gain weight back. And there are some person that they will not be able to lose weight. We have to consider that as well. Mm-hmm. So the prevention is supposed to be directed to prevent those people of gaining more weight, because the more weight you gain, more comorbidities you will develop.
So to maintain the weight, is there any program for it? What kind of program?
After losing weight?
After surgery, after losing weight. Is there a program to
It is
follow?
Important. No matter what type of program you decide to take to lose weight, meaning change your lifestyle, medication, surgery, you have to commit yourself to keep your weight. And the only way to keep that weight that you have lost is a good physical activity program, healthy nutrition, and you have to grow muscles. Because that is the problem. When we lose weight, we lose as well lean tissue. It means we lose muscles. And our muscle, the amount of muscle is connected to our metabolism rate. So if we lose muscle, then we will increase weight. That's why it's so difficult to keep the weight you lose.
Mm. So can obesity shorten life expectancy?
Definitely. It can be reduced, the life expectancy, even 40%.
This is scary.
It is, due to all the comorbidities. A person with that develop obesity, for instance, severe obesity for approximately 10 years, is at a very high risk to develop diabetes type 2 and all the complications.
And it can lead to cancer.
Not to cancer, but to various cancer. You may develop kidney cancer, breast cancer, bowel cancer, a lot of cancers. Of course, this will shorten the lifespan.
So what is the health risk of obesity?
It is huge. There are more than 20 comorbidities that you can develop with when you have obesity or overweight. as I mentioned right now, you may develop diabetes, you may develop dyslipidemia, you may develop cardiovascular diseases, you may develop psychological condition. This is very important. 50% of obese people, they develop depression and anxiety. This is very important. Joint condition, they may develop knee osteoarthritis. They may develop a lot of cardiovascular condition as well. It is very risky.
Based on a person's current weight and eating patterns and goal weight, how many calories a day should that person eat to lose weight?
Yes, we cannot fix this in numbers. It is difficult because it's really connected to that person's height, weight, physical activity, and what they do, I mean, the daily life activities. But definitely, the calorie intake is supposed to be less or similar to what we are going to spend. Because if we ingest more calories than we are going to consume, then we are going to gain weight.
So weight loss surgery, you as a consultant and surgeon, do you think it's a good choice?
Definitely no.
Why?
This type of surgery, they are very mutilating. They can change by the way, what we produce when we do the surgery to lose weight, it is a malabsorption condition. So we put the patient to eliminate as a waste the food that they are eating. But it's not only the food, but as well they are not going to be able to acquire the nutrients they need. They are not going to get the vitamins they need, the minerals they need. So they will be forced for life to use supplementation. And as well, they will develop a lot of, they can develop another complication secondary to the surgery. So definitely, surgery cannot be the solution.
So apart from surgery, what do you recommend as the solution? If like a person have done like, I don't know, 1,000 times exercise, do everything, nothing's working. So the other solution that she or he is in her or his mind is surgery.
Well, as I mentioned before, we cannot blame people for this. This is a health. I mean, not only there should be not only own people's commitment, but as well it has to be government commitment. This is a worldwide problem. Obesity is considered now an epidemic problem. 1 in 3 individuals are obese or overweight in Europe, in the United States, in the Emirates, in China. And the way it stands today, it is worse in Seychelles. And we are not talking about that. It is worse in Seychelles. So, and it's going to get worse. Why? Because there is a recent research done in Seychelles that 50% of the children between, I think, 8 to 10 years, they are obese. So what is Seychelles' future?
But why can't we manage our body weight?
Because it is difficult. On that research, it was asked to the children what was their preferences to drink. 25% said water, 75% sugary drinks. So this has to be government politics. They have to increase, for instance, like they are doing in other countries, taxes on fat, on sugar drinking. Drinks, they have to do that.
Sugary drinks.
Have to increase, like they did as well with tobacco. It has to be done with this type of food. They have to be more proactive. I know they are working, but it's not enough. It's not enough.
So fight against obesity. Can we win the war?
We are on high risk of not getting the job done. If 50% of the children is obese, what is the horizon that we have for this condition? It is really serious, because this will put a lot of pressure on the health system. For instance, I think in the United States, and it cannot be different here, I think they spend more than, I think they are spending around 5% of gross net income to treat obesity and obesity-related comorbidities. So this is a lot of money, and it has to be tackled. They have to start doing something.
So what can be done to stop this global epidemic?
The most important is prevention. It's prevention, and prevention has to start with the children. Because if we have children already with obesity, that's sure that they will be obese in the future. This is only prevention.
So BMI.
How to prevent that? We have to learn to teach people healthy habits. We have to, for instance,
we
for
need
the
to
children.
educate them.
We have to, for the children, they cannot be in front of a computer or laptop or these board games all day long. We need to go back to what we used to do previously, to play with the ball outside, for instance.
Exercise.
Yeah, physical activity. We have to increase our physical activity. And we have to go back to the way we were eating before. Now in Seychelles, you see a lot of imported food that you were not consuming before. All this fried that you get in the shops. This is what you wanted eating that before. Seychelles before was a healthy population.
Yeah. 6 months ago, you were here to perform surgery, and now you're back again. So what is the development? It's on the increase? Your surgeries now in Seychelles?
No, we are not. We haven't managed to perform surgeries here. But now what we brought now is a new development. It is an American device. It is an intragastric balloon. It is a surgery-less, no surgery needed for to treat obesity. The name for this balloon is ellipse balloon.
Or we can call it gastric balloons.
Gastric balloon. There are many types of gastric balloon. The difference on this is that for this you don't need endoscopy, you don't need anesthesia, you don't need surgery for insertion or removal. That's the most important of it. This is a new device, recently launched in Europe, and is giving good results. Previously, the intragastric balloon was not accepted as a good method because there was a rebound after the losing weight. But nowadays we know that after all type of surgical procedure, if you don't change habits, if you don't go into a healthy life, healthy eating habits, good physical activity, you will gain your weight back, no matter what you do. So this is a very good procedure because there are no risk of suffering the same consequences of surgery, and you have the chance to lose at least for 3 to 4 months between 15 to 30 kilograms. It depends on the patient's commitments.
Wow.
So it is the same that, if there is no commitment, even if you do a gastric bypass, you will gain weight back.
You will?
Definitely. Definitely.
But how does it work, the gastric balloons? How does it work?
The gastric balloon. Well, it is a balloon that we have to will inflate into the stomach. This will occupy approximately 50 to 60% of the gastric chamber. So just by doing this, patient will be forced to eat a small amount of food. And as well, the balloon into the stomach will produce that the patient will have the digestion and the evacuation of the stomach will slow down. So it means that you will not feel hunger for a longer period of time. And definitely this leads to lose weight. That's the way it works.
But is it risky on your health?
Not really. It doesn't need surgery, no anesthesia. It's just a capsule that you have to drink. We have a video that we will play later, so you see this is an easy procedure, 20 minutes, and the patient can continue with normal life.
Mm-hmm, mm-hmm. How does it feel after the implantation of the ellipse balloon?
Okay, most of the patients, they refer that they have some nausea, some abdominal discomfort. It is normal because you will have a balloon inflated in your stomach.
For how many days?
No, usually it is a short period of time, 2 to 3 days, but because we know that, we prevent it with medication, proper medication. Something important that I didn't mention in the causes of obesity is sleep deprivation. And we don't consider that as when you don't sleep properly, 8 hours, you are on high risk of gaining weight. And
so it is true that sleeping makes you lose weight?
If at least I can tell you, if you sleep well, you will not gain weight. And if you don't sleep well, you will gain weight. And there are two reasons for that. We produce two types of hormones. The ghrelin. When you don't sleep well, you will produce more ghrelin. And ghrelin will increase your appetite. And there is another hormone as well, that when you don't sleep well, you will produce less. And this hormone is responsible for satiety, so for make you feel full. So that's why when we don't sleep properly, we can gain weight. So it is important as well.
Talking about sleeping, there are people that they have their dinner like say 8:30, 9 in the night, and they don't have rest, and they directly after dinner they go to the bed and they sleep. So what can be done there? Does the body digest or not?
It will digest. It will take hours, probably longer than necessary. But what is going to happen is that when you go to sleep, what is the purpose of sleeping? It's body maintenance, repairing what has happened during the day. And to repair the body doesn't need a lot of carbohydrates. We need only proteins and some minerals and vitamins. So a small amount of salad will be enough. So when you have a late lunch, and especially overloaded with carbohydrate like rice, bread, that excess of calorie intake that we are not going to use because we are going to sleep is going to be converted into fat. So we are going to gain weight.
And it stores in the body.
That's it. We'll gain weight. When we eat late, we'll gain weight.
So with the gastric balloon, how much weight can we lose?
Well, as mentioned, it depends on patient's commitment. But in my experience, minimum you will lose 15 kilograms on the first 2 to 3 months. This is the period where patient they lose more weight. But if there is a proper commitment, patient can lose 30 kilos with the intragastric balloon. And the point is that they have to embark on healthy habits, because when you, the balloon will be expelled from the body naturally, because it's the way, we don't need to remove it. Similar to other procedures, if the patient do not follow the guidance, if the patient don't go into healthy habits, he will gain the weight back, no matter the procedure that has been done.
No matter the procedure.
Even if it has a gastric bypass, vertical gastrectomy, you name it, will gain the weight back. That's it.
So what is the difference between this gastric balloon and the gastric bypass?
It is a huge difference. To do a gastric bypass, patient has to be admitted to the hospital, will probably need a week to be for recovery. There is a lot of chances of developing complications. And the problem of malabsorption, the patient will need for life supplementation. For the intragastric balloon, it's very straightforward. It's a 20 minutes visit to the doctor. You will get the balloon into the stomach just with a glass of water. Sometimes it needs some help from the doctor, and you will continue with your normal life. It's a huge difference.
Is there any person so far that have used the gastric balloon?
Yes, many. I mean, we have.
So what is the reaction?
We have been using the intragastric balloon since probably, for the last 10 years. What is new now, the ellipse balloon, for the ellipse balloon is not needed anesthesia, surgery, or endoscopy. Not for insertion, not for removal. And the new about it is that we now know that the patient has to embark on healthy habits, not only for the intragastric balloon, but as well for surgery. But before, we used to insert the balloon, give some instruction to the patient and forget about them. That's why there was a rebound on the weight gain. Now, we are convinced that's why it is a program. It's not just a balloon insertion. It is a 6-month program that has to be followed up.
But tell me, now that you're here in Seychelles, you are educating people for the gastric balloons. So do you have some patients now?
There are some patients interested already. So this is a process. This is a decision that to be taken this time and consideration, because this is a program. It's not only balloon insertion, because most of the patients think, okay, I get the balloon and I forget that I can eat the
And
way
I
I
lose
was
weight.
eating, and no chance. It doesn't work like this. So they have to commit themselves to embark, and they have to embark themselves on healthy habits of eating and activity.
You have to follow the program.
Definitely. If not, you will lose weight, that's for sure. But then, once we finish and the balloon is excrete, you will gain your weight back.
So for how long you have to take the tablet?
Well, for interactive balloon, there is
Yes.
only one capsule that you have to...
Only one.
Only one. And then the balloon will remain in your stomach for approximately 4 to 5 months. And there is a automatic way of, there is a leakage after 4 to 5th month, on the 5th month, and the water that we put inside the balloon will be released. So the balloon is going to be passed out away normally, naturally, in the stool.
And then you have to come back, or that's it? 5 to 6 months, that's it?
No, I mean, when the period of learning, education is finished, you're supposed to continue with this. No need to go back to the doctor.
Just,
To continue the routine.
but you don't monitor it?
We monitor it, and especially the patient, because with the balloon, with the device, it comes a wireless scale and APP. So a patient can monitor the progress. So he can see how much he's losing. If he's not losing, then we can determine the reason and work on that. But this is important, the commitment of the patient.
So now the big question. What is the cost for it?
Important. This is not just a device. It is a program, 6-month program that you will have initial consultation, then the balloon cost, balloon insertion, monthly follow-up with nutritional tips, physical activity tips, recommendation. Sometimes as well we need to do as well a psychological assessment, because a lot of patients with obesity, they already have a lot of psychological condition. 50% of them already have suffer depression. And the scale comes with it as well, and the APP. The cost for this approximately, you have to consider this, it's 6-month program. It's not 1 day insertion of balloon. It is approximately 60,000 Seychelles rupees.
60,000 Seychelles rupees. O que dá com Seychelles entende pour incision comme ça pour sa tablette et pour coûter nous 60,000 roupies la Seychelles si on peut envie à faire un gastric balloon pareil nous peut dire là bon matin. So 60,000 rupees for Seychelles for a 6-month program.
6-month program.
And if you want to follow another 60,000.
No. I mean, it is like learning these habits is like learning a language. It depends how fast you want to go. For instance, there are some balloons that they last into the stomach for 12 months. So for those patients that they are not keen to learn fast or to acquire fast what they have to, the education, then probably we need longer. But usually this is not the case. Patient has to commit, and within 6 months they will get it done. Most of the weight that the patient loses with balloon insertion, with all type of balloon, not only this, it is done during the first 3 to 4 months. So no need to have the balloon longer.
So what can you tell the people of Seychelles now that you are here and you will be going on the 21st of June? What can you tell the people of Seychelles to convince them, maybe those who want to come and try for the gastric balloon or gastric bypass, we don't know, the people who are obese, who are consider themselves overweight. So what can you tell them?
Okay, I have to tell them, sadly, dieting, exercising, medication to lose weight, going to the gym, it doesn't work. It doesn't work. Approximately 75% of persons that do this activity, they are not satisfied with the lose weight. So it doesn't work. This interactive balloon is just a tool for them to embark on healthy habits, because using the interactive balloon will prevent you of being distressed when you don't eat. this anxiety because of not having food, this hunger. That's why this program is important, because you can lose weight in a appropriate manner without suffering what usually they suffer when they have to go into diet. And if they follow the program, if they learn, if they have proper education, they can continue with what they have learned for life. And that's it. You cannot change. Whatever you do to lose weight and you go back to your previous habits, you will gain weight back and even more. So sadly, I have to tell them that they need a tool. If it is a surgery or interactive balloon or something different, but they need a tool. Because you don't lose weight by dieting.
And
because what I mentioned
willpower.
before, what I mentioned before, because when you lose weight, you lose lean mass. It means you lose muscles.
Muscle.
And when you lose muscle, your metabolic rate will fall down, and then you will gain weight. And as well, we can say that we have two types of brain. Let's say it's so people can understand. The primitive brain, like all animals, and the gray matter, or that part of the brain that the difference from animals, from animals. And this is under the primitive brain control, like almost all important activities. So when you start losing weight and you skip meals, for instance, the signals that goes to your primitive brain is of danger. Because when you don't have food, there is no energy, you die. So what do you think the primitive brain is going to do when there is that signal of losing weight? It's going to invert the metabolism. Will reduce the metabolism rate down, will invert it completely to not burn fat, because it's the way we have to store energy. And every time you eat, then what do you think is going to happen? Instead of using this for a metabolic process, it's going to convert it into fat.
Into fat, yes.
That's why people, when they try to lose weight, they gain more weight. Mm-hmm. That's why it's too difficult to maintain healthy weight after losing weight. Mm-hmm. They need a tool.
And that tool is?
That tool can be intragastric balloon, for instance. This is very good because associated risk is below 0.1%. No need anesthesia, no need surgery, no need endoscopy. So this can be a good tool. You will have a wireless scale that you can connect to your phone, so you can monitor your progress. You will be oriented, because it's a program, by a doctor with nutrition knowledge. You will have a minimum monthly follow-up.
A person's BMI is for overweight is between 85 to 94. It's considered overweight. So what is obesity?
Okay, for BMI, it is considered when approximately overweight when it is between 26 to 29, almost 30. Above 30, it is considered obesity. And this obesity as well has several degrees. It can be type 1, 2, 3, and morbid obesity.
Mm-hmm. So for the gastric or ellipse balloon, who is eligible to perform this? For example, if a person wants to do it, consider themselves obese or overweight, but they do have some health problems. Can they go for the gastric balloons?
Definitely, because losing weight first will prevent comorbidities to develop as well. And when you lose weight, all those comorbidities as well that you already suffer for things, for example, diabetes, can be controlled. Most of the people, type 2 diabetes, when they lose weight, they stop taking medication. The blood pressure can be controlled. The cholesterol, dyslipidemia can be controlled without medication, just by losing weight. So probably the sicker they are, more interesting for them is to undergo this type of programs. And the good about it is that when you are going to have, for example, a gastric bypass, you have to be fit for the procedure. But
because there is complications.
Of course. But for the intragastric balloon, no matter how sick you are, you only need to swallow a capsule. The only things that will prevent us of using an intragastric balloon is a gastric surgery or bowel surgery. That's the only one. Apart from that, almost all patients are good candidates for this.
Anyone can do a gastric balloon.
Yes, but not every patient needs or can go undergo for a gastric surgery.
Only
Bypass
if you are
surgery.
overweight.
No. I mean, for those overweight and obese people, or not all of them can undergo the surgery because of the risks that they have before the surgery. That's it. But for the intragastric balloon, almost all patients are good candidates.
Voilà, c'est celle ou qui de la cour qui peut écouter nous si vous pouvez considérer pour faire un gastric bypass ou bien pour un gastric ballon, pareil nous dit, mais seulement au besoin assiser, réfléchir à cause il y a une complication qui viennent avec. Et aussi, pareil nous dit que nous besoin souffrir. Il faut souffrir pour être belle. So, Dr. Licea, anything more that we should know about the gastric balloon or obesity on itself?
Well, I think I have mentioned already for intragastric balloon. I think this is a good tool. There are other tools, but this is a very good tool because the low risk of starting the program, because there is a 6-month follow-up program. But the most important is to raise up awareness about obesity. Obesity is a disease, it's a serious condition. Obesity has a lot of comorbidities. People die due to obesity. Lifespan due to obesity can be reduced to 40%. So it is important. And the cost of obesity-related comorbidity is higher than the price for intragastric balloon, physically and economically, for instance. So it is important. People have to take care of their own health, but as well there has to be a commitment from the health authorities. Mm-hmm. If not, the horizon is not good.
We can say you have to promise yourself, you have to make a commitment to yourself that I'm going to do this, no turning back.
Definitely. And patient, they cannot as well be waiting for the health authority to do something. They have to commit themselves to embark on changes. It is important.
At the end of the day, you will say, you look yourself into the mirror and you say, you are beautiful.
That's it. To gain some confidence back.
You gain some confidence. So, Dr. Licea, thank you so much for this morning, for all of the details, and for the new device called gastric balloon that you are here in Seychelles to educate the people of Seychelles. Maybe they will consider, but we know that some Seychellois do consider for gastric bypass, or otherwise they just lose weight by exercising, by the cultural assisting like that. Yeah.
Thank you for inviting me. Thank you, Seychelles, for hosting me every 3 months. I am very happy to be back, and I will continue coming back here. And probably in the near future, I will decide to stay.